Hey guys, welcome back to my channel. And today we are going to react on infant vital signs, pediatric nursing assessment, newborn, by registered nurse RN. She has like very good videos. You guys go and watch it, and she's really good at what she does, and she explained really good. So let's watch the video and learn with her.
Infant. So let's get started. When assessing vital signs on an infant, you want to start with the most non-invasive vital signs first, while the infant is calm and resting. Therefore, first you're going to check the respirations, followed by the heart rate, then the temperature, the weight, the length, the head circumference, and then the chest circumference. Before you assess the infant's vital signs, you want to make sure that you gather your supplies. So what you're going to need is an infant-sized stethoscope, followed by a measuring tape, a thermometer, a scale, and a watch to count with. And you'll want to make sure that you sanitize everything that you're going to use on that infant before and after use, and of course perform hand hygiene before beginning. First, we're going to check respirations, and we're going to do that first while the infant is laying here nice and calm so we get an accurate reading. And a normal respiratory rate in an infant is about 30 to 60 breaths per minute.
So for adults, is the opposite, it's 12 to 20 breaths per minute, but for infants, it's 30 to 60. So
Before we even start counting respirations, we want to look at that infant and we want to make sure that they're not in any respiratory distress. So one way we can tell is we can look at the nose. Infants love to breathe through their nose. So we're checking their nostrils and we're looking for nasal flaring. And if you see that, that's not a good sign. Also, you want to look at that chest and you want to look for anything like chest retractions. And what that looks like, it literally looks like the skin has just been pulled over the ribs and you can see the ribs very well. And this infant does not have either of those things. In addition, you want to look at the infant's skin color and make sure it's appropriate for their skin tone and that you don't see any signs and symptoms of cyanosis. So to count respirations, what we're going to do is we're going to count for 1 full minute, the rise and the fall of the chest. Now, with an adult, you probably remember that if the rate was regular, we could count for 30 seconds and multiply by 2. Well, this isn't the case with the infant. You're going to do it for 1 full minute because infants' breathing pattern is irregular. They have what's called periodic breathing where they'll breathe and then they'll stop for a second. So we're going to count for 1 full minute and we're looking at that rise and that fall of the chest. And infants like to breathe abdominally, so if you're having trouble, what you could do is you could lightly place your hand on the chest and feel the rise and the fall. But you want to be careful not to disturb the infant and get them crying. So I'll demonstrate and I'll count with each rise and with each fall just to give you an example. So here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So you want to count that rise and that fall for 1 full minute and then document that number.
or you can use the bell side and listen to that. It's small side here. You can listen with it and then count by like tapping either your leg or your hand to follow the rhythm, and you go 1, 2, 3, 4, or either with your leg and start count. Because sometimes it's so fast and you want to even um like hear it, so you have to go with either. Like, that's what I usually do. I go like 1, 2, 3, 4, 5, so that like I go with the rhythm.
So his respirations were 38, which again is normal because the normal rate is about 30 to 60 breaths per minute. To count the heart rate, you want to make sure that you're using the appropriate size diaphragm and bell, and we have an infant here, so we're using an infant size. And for an infant who is less than a month, a normal heart rate is about 100 to 190 beats per minute. And this can vary if the infant is crying or if they're sleeping. Now, if the infant is over 1 month, that heart rate goes down a little bit, the normal ranges, and it's about 90 to 180 beats per minute. So to count the heart rate, what we're going to do is we're going to use the apical pulse. We're not going to use the radial pulse like how we do in
For adults, it's different. So now we are focusing on infant, but for adults, it's like 60 to 100 beats per minute. But for uh, babies, we were taught like it's on the textbooks, it's 110 to 160 beats per minute. So when we check the normal, and why like why the heart beats like faster than the adults. It's because of like three things. We started because of their small heart, and their tiny hearts hold like less blood, so they must pump much uh, faster to circulate enough oxygen. And then the second one is like fast metabolism. Like infants, they grow rapidly and burn energy quickly, so they require constant blood supply. And then the third thing why their heart rate is like so faster than adults is because of their immature nervous system. So their nervous system is still developing, making their heart rate spike easily, either when they're crying, when they're eating, or like their temperature is when they have like pain, their temperature like goes up the roof. So I think it's because of that.
In adults. So to find the apical pulse, what you want to do is you want to find the fourth intercostal space. Now, in an adult, remember it was the fifth intercostal space at the midclavicular line, but for an infant, it's at the fourth intercostal space lateral to the midclavicular line. So you want to find the clavicle, and then we have the breastbone. And we're going to go down and we're going to fill in between those little ribs, and we're going to go to the fourth space. So there's 1, 2, 3, 4, and then we're going to just go lateral to the midclavicular line. So we're going to go about right here, and this is about where the apical pulse is on our infant. And we're going to place our stethoscope there, and we're going to listen for 1 full minute. Now, an infant's heart rate can have sinus arrhythmia, where it's irregular because their heart rate can be affected with the respirations, where their heart rate will actually speed up and slow down with respiration. So that's where you want to count for 1 full minute. Now, counting an infant's heart rate can be difficult because it is fast. And one thing that I have found that definitely helps me is I find that heart rate, and then I like tap my finger along with that heart rate and count. And our infant's heart rate here is about 142. To check the temperature in the infant, we're going to check it via the axillary route. So we're going to
So 142 is not that high. It's like normal heart rate, because we see the heart rate is 110 to 160, remember. So 142 for them it's normal. But for adults it's like no, that's so fast.
place the thermometer tip in the armpit of the infant, and I've already placed the little protective sheath over the thermometer. So a normal temperature in an infant can vary anywhere between 97.5 to 99.3 degrees Fahrenheit. To take the temperature, make sure that you turn the thermometer on.
Looking for bite-sized, high-yield NCLEX videos? UWorld's high-yield NCLEX videos are designed.
And then you're going to place the tip of the thermometer deep inside the fold of the armpit, and then you're just going to put the arm down, and you're going to wait for the thermometer to beep to tell you the reading. Okay, our thermometer is beeping, so it is done, and the reading is 99.1. So we would document this, and this falls within normal range. To obtain a weight on an infant, you want to remove the infant's clothing and any soiled diaper. A dry diaper can be used. So place the infant on the scale and obtain the weight. Here, this infant weighs 10 pounds, 2 ounces. So you want to document that weight and then look at the infant's previous weights. This patient weighed 8 pounds at birth, and now at this 2-week appointment, they weigh 10 pounds.
So we were told yesterday, actually, when we went to school. So we were told like the birth weight. So I just wrote it here. So the birth weight of a baby. So the current you weigh the baby, and then so you put the birth weight when it's, for example, let's say 3,756 grams, and then you go and weigh the baby, and then the current weight, let's say like is 3,620 gram. So what you do is the birth weight minus the current weight. So whatever you get, like for example 3,756 minus 3,620, I'll do this, I'll show you. So if the birth weight is 3,756 grams and the current weight is 3,620 grams, so what we see is birth weight minus the current weight, you get like 136 grams. Divide by the birth weight times 100 is 3.6%. So the baby's like normal like percentage like 10%, and that's how you get like their actual weight.
2 ounces. So that is a very good weight gain from their birth weight. To measure length, what you want to do is you want to lay the baby on a surface that you can mark. You'll need a pin for this, and you may need someone's help to help you measure the baby, because you're going to measure from head to heel. So lay the baby back. You'll want to put their head midline like this, and then just mark their head. Then you want to take the leg and extend it outward like this. Make sure it's nice and extended. May have to work with them a little bit. And then mark it at the heel. And a normal length in an infant is about 18 to 22 inches. And then we're going to gently lift the baby up. So we're going to measure this, and we're actually measuring this in inches, and the infant is 22 inches. To measure head circumference, you're going to need a measuring tape, and you want one that measures in centimeters. Now, a normal head circumference in an infant is about 33 to 38 centimeters. And what we want to do is we want to place the tape measure around the largest diameter of the head. So to do that, we're going to place it a little bit above the eyebrows, and then we're going to wrap that around and place it around the most prominent part at the back of the head. So let's do that. So gently just lift the head up and put the measuring tape behind it, and then pull your measuring tape around, move his head a little bit. And let's see what we get. And his head circumference is about 37 centimeters. To measure chest circumference, you want to get your measuring tape. Again, you'll be measuring this in centimeters. And you're going to take it and use the nipple line as your guide. So you're going to wrap it around there and then measure it. And his is about 36, and this should be about 1 to 2 centimeters less than what the head circumference was. Okay, so that wraps up this demonstration on how to assess vital signs on an infant. And be sure
So thank you for watching the video with me, and we'll see you on the next recording. Bye bye.